Okay, so if you have tight muscles, neck tightness, shoulder tightness, you've heard the term trigger point, using the Theracane can really be a game changer to help give you some relief on that. All right, today we're going to go over some tips, our pro tips on how to use the Theracane. If you've got tightness and pain in the neck and shoulders, a lot of people have these and often don't know how to use them. So what I want to walk you through is how can you use the Theracane to effectively relieve some of the tightness of those trigger points in your neck and shoulders without making yourself worse. So let's talk about what a trigger point is. A trigger point is a small area of tight tissue. Usually the muscle fibers are continuing to contract, and you've all felt them, particularly up in your upper trap. We all get a little bit tight where you press one area and it creates pain in another area. So that is a typical pattern of trigger points. Now keep in mind that that is different from referred pain that you get from a nerve or you get from other areas. Everyone's heard of phantom limb pain. So pain is an elusive phenomenon, but trigger points can send pain to other areas, and they're often not very serious, but they can be miserable. So if you have one of these, we're going to talk about how to use them. Now, what you don't want to do is just grab the Theracane and just really beat the heck out of yourself and just push aggressively. I've seen this happen a lot where people would kind of find an area and just kind of dig in. You don't want to do that. The other thing you don't want to do is when using the Theracane, you don't want to hurt yourself. So you want to make sure that your wrists and shoulders are in a relaxed position, that you're not reaching too far, you're not twisting your wrist or torquing your wrist in any way to make one area worse to deal with another area. So one of the most common areas for trigger points is in the back, the upper trapezius muscle. Now keep in mind, I'm going to point with this cane. The trap really starts way down here, up by your lumbar spine, thoracic spine, comes all the way up to the top of your head, comes all the way out to your shoulder. And right in this spot here, most people have a trigger point. That's right where the levator scapula meets the upper trap muscle. It happens when we have poor posture, when our head comes forward or our thoracic spine flexes. So watch our video on posture and how important that is to prevent headaches and neck pain. So what you'd want to do for the upper trap is you're going to take the large nodule. You've got these handles here. The first thing is to be in a relaxed position. So if you want to sit with your back in a chair, that's helpful. You want to make sure you're on a comfortable surface and you're not reaching. So in this case, if I'm treating my right side, I'm going to take the cane and go over the right shoulder. I'm going to use my left hand over my left shoulder, left hand on the top, right hand on the bottom, and I'm in a relaxed position. And I'm finding that spot that's really tender. So I find that spot right there, and I'm going to turn to the camera. Right there, I have a trigger point. So what I'm going to do is I'm going to gently rub right up and down that trigger point for about 2 minutes, or until it starts to itch. And that's a sign that I'm increasing the circulation on that area. But I'm making sure that I'm not stressing my right wrist or my left wrist, and I'm in a comfortable position. And when you're using this Theracane, use it for 2 or 3 minutes. Now the other thing you can do is when you find that point, just kind of put some pressure on it and relax. So right now I can feel that point on my mid-trap. It hurts just a little bit, but I can feel it kind of relaxing. And if I work this for about 2 minutes, that point's going to relax and feel better. You do not want to leave bruises on yourself. That does happen occasionally, but that's not the intent. If it happens, then just lighten up a little bit. You do not want to make your problem worse. So if whatever you're doing, you feel like you're making your problem worse or creating new problems in your wrist or your shoulder, you want to stop doing that. So we have videos for very specific muscle groups, particularly to relieve headaches. So watch those, and if this has been helpful, please like, subscribe, smash the love button.